the mapping exercise started at that time. I mean, some mapping had already been done because in part of the clinical history taking that you have with patients, you will find out what it is that you're searching. And at that 2 o'clock, after 2 o'clock in the morning, we were still in discussions with the family members as to where, trying to identify any possible contacts, any possible person that he may have been in contact with that could have gotten him infected. So the preliminary report has been produced from the San Ignacio area because he is from San Ignacio. I had mentioned earlier that he was seen at 2 private facilities before he arrived on Tuesday evening at the Western Regional Hospital. That one of those was only seen by one doctor and had slight interaction with a nurse, and in the other private facility interaction with 2 doctors. Those 4 health staff are now obviously in isolation. One of the doctors that saw him initially actually had been off a shift as of Sunday, so he has not been interacting with anybody else since then. All these doctors are asymptomatic, and they would seem to have had minimum contact in terms of potential exposure, but they still have been swabbed. From that initial mapping in the Cayo area, there's immediate contacts, close contacts in the same household. Those have been swabbed, and there are at least 20 swabs that are going to have been taken from the Cayo area and the people who he would have interacted with at the regional hospital. We are going to start running those samples later on today. Central Health Region is doing a mapping exercise in Belize City because that's where his workplace is. And that seems to be the link that we have for right now. It would read through his workplace. Doesn't seem to have a strong positive history from contacts he has in the Cayo area. The patient doesn't have a travel history for the month of February or March. His last travel history was in late January, and that was in Florida. So it wouldn't seem to match his current case with having been exposed if he did not had a travel history. So it may have been somebody who had traveled and then eventually got him to be positive for COVID-19. Our mapping exercise is not going to be able to tell us right now whether we have him as a community acquired transmission, but it seems to be that the link is going to be from his workplace in Belize City.